Just had my first session. This one was a neck case too. This patient came with a numbness and tingling going down towards the arm, elbow region, but also a little bit of the hand. So I ended up working the neck. First, what I did is I assessed, turned to the left, turned to the right, just to see the range of motion and where the restrictions were felt. I also felt, as I side bended, I felt a stiffness on the right side at the levels of 3 and 4, and so I felt stiff in that joint, and when I pressed a little bit on it, it elicited a little bit of symptoms. So what I try to do is I just try to do a little bit of distraction for that. That's going to help one open up the spaces within the joints. We opened up, do a little bit of distraction, we side bended and rotated to kind of help that joint glide and open up. I did that multiple times, and it was very stuck. So it wasn't able to kind of unlock itself. So what I did next after that is I worked along the laminar groove in the sideline position, trying to get those muscles of the neck to relax because they were very stiff. They were very tense. So as I was carving out the laminar groove, I found two tender spot that I just held there with compression. And then I had to do a little bit of motion to kind of get those muscles moving so we can thread the needle in the sense of pressing and rotating as we move the muscle in different directions. Up, down, side to side. So I went into the laminar groove from levels of the back of the base of the head down to the mid back. And what I also found was at level 1, T1, T2, and T3, there's a lot of stiffness in that rib joint complex where it connects and butts up into the spine. So as I was moving in that area, I just tried to do a little bit of oscillation, rocking motion to get those joints moving a little bit more, but it wouldn't budge. So I pressed her down and I did some rib springing, and I still wouldn't budge. So this just, I tried muscle energy techniques to kind of help open that up, and that helped a bit. It improved a little bit of mobility in that area, but she was still having a lot of stiffness. So she did mention that towards the end of the day, she was having a lot of in the back of the neck or pain or discomfort from fatigue. So I ended up placing kinesio tape to help support her neck so that throughout the day her neck is not getting overworked and discomforted. So we did go ahead and did that. So hopefully we're going to see her again next week to kind of help open up those areas some more. Hopefully by next week we can kind of get those joints moving even more to reduce that irritation that's happening on the nerves, and to further reduce that discomfort down into the arm and hand. So hopefully she feels better throughout the day. But overall, it was a good session. We'll see our next session coming soon, and so I'll keep you guys updated on that one.